Can you talk about what that would mean for you or your family?
Yeah, absolutely. I actually, before the ACA, I remember having meetings with our state chapter social worker, the Huntington Disease Society of America social worker, and discussed the pros and cons of testing and how to go about it. And we looked into options if I did have a positive test, and there was not a single affordable option. In fact, I'm not sure if there were any options for me for that. Like I said, luckily, I did not test positive for that. However, it's very important for me to know for the future of my children that no matter what comes their way, they will be able to have health coverage.
Now, the Trump administration is actually taking some action on health care. It has taken some unfortunate action, which is to increase the potential deductibles. It has issued new rules to increase deductibles. How would that kind of rule affect you? In other words, letting insurers charge higher deductibles as a solution to, quote, improper enrollments. What would it mean for your family if your deductible were to double next year?
That would be a big no, thank you. That is absolutely not help. We do have things come up. We are a healthy family. We have sports injuries and things like that. So having a high deductible does not help the situation at all.
My time has expired.
Okay, some more points of clarification. The ranking member has a tendency of quoting me out of context. I don't appreciate it. I believe when I used the term dismantled, I talked about the way Obamacare dismantled the individual markets and caused, through its faulty design, premiums to skyrocket. When I talked about high-risk pools, I'm sure I always add they weren't perfect. They would have some modifications to make sure that people with pre-existing conditions were covered. Every state high-risk pool were different. Some worked better. I'm saying Wisconsin, the way it was set up and what it did, it worked beautifully. It worked beautifully. Take a look at the successful models. I think they had a great model in Maine, correct? But anyway, that's Senator Scott.
Thank you, Chairman. So, Ms. Verdon, what did you pay in 2019? What did you pay a month for your health care?
Guys keep asking these numbers. Let's see, 2019. What did we pay? I believe, oh boy. 2019, I believe, was our will you help me? You've got the numbers. I believe that was our, before we dropped to a lower tier plan, $1,000 a month. Yes, that was a.
What did you pay in 25?
This past year, $460 a month.
So why should it go down? Did your income go down?
What's that? We selected a lower tier plan, and then we also have the extended premium tax credit that's helping us too.
Okay, and so if the Biden COVID era, what would it go to? If those were extended, what would it go to?
So what would it? Well, I don't know exactly what that would add on, but currently this year we have about $800 in assistance from the extended premium tax credit. So I assume it would help us at least another $200-300 next year.
You don't make less than 400% of poverty, right? Your family doesn't?
No.
Okay. All right, Dr. Place. So Senator Haston said that in New Hampshire, I guess, that a family of two, if they, if we don't extend this, a family of two, it just skyrocketed, the premium. So what actually would happen if it was a family of two in New Hampshire? Do you have any idea? Aren't they within 400% of the of poverty, and so there's almost no change?
So the underlying Obamacare subsidies, which the chairman said are permanent and aren't going away next year, they are very large. They limit the amount of premium that people have to pay for a plan. So as premiums have skyrocketed over time, the enrollee share has basically remained the same. The vast majority of enrollees are lower income, and they will continue to receive large subsidies next year. So the vast majority of the premium for the vast majority of enrollees will be paid by the federal taxpayer. Most enrollees will pay less than $80 a month for coverage that costs, up to $1,000 a month for single coverage because of the design of the credits. The subsidies in Obamacare only went up to 4 times the poverty line. The idea was that coverage, when they were trying to limit the cost, but those people didn't need subsidies at that level. The problem with Obamacare is it has so increased the price of coverage over time, particularly for older couples, that it has led to very high premiums for them. So they do face higher premiums above 400% of the poverty line if the subsidies expire. But it's a very small percentage of the overall Obamacare enrollees that have that income.
But if you're in New Hampshire, I mean, you're making $85,000, you're probably within 400% of poverty, aren't you?
For a couple of 2, you're probably just above four times the poverty line.
Okay, so your number's not going to change.
If you're under 400, you will still get a large subsidy. But it's the people just above 400 that are going to face the largest.
Who did the Democrats design it that way?
That was one of the main features of the 2010 law, yes.
Okay. All right. Why would they do that? I mean, this is their design. They were supposed to, and I assume they were generous and covered the people they thought they had to cover.
In 2010, in 2009, President Obama said he would not sign legislation that increased the deficit by a dime. Now, once the law was signed,
supposed to save like $100 billion?
There were several financing gimmicks. There was a student loan takeover, which has clearly cost money. But what Congress has done is repeal the health insurance tax, the Cadillac tax, the medical device tax, the independent payment advisory board. Most of the cost savers in the law have been repealed, which leaves just a giant spending
So what's the deal?
provision.
They reduced the cost of Obamacare, didn't they? They wouldn't have reduced the revenue without reducing the cost, would they?
So Obamacare is now significantly contributing to federal deficits, and these COVID-era credits, the Medicaid expansion, because of the bad incentives with states when they're spending and getting $9 in federal money for every dollar of state funding. Like Obamacare is significantly contributing to federal deficits and debt.
So, Mr. Bragdon, can you walk us through the fiscal impact of erroneous or fraudulent Medicaid enrollment that stems from Obamacare's relaxed verification standards? I'll just give you some numbers when I was governor. So when I walked in as governor, January 2011, we had a horrible economy. So over 8 years I worked on, we added 1.7 million jobs. We took the number of people on unemployment from over 900,000 to 61,000 by getting people a job. We reduced the number of people on welfare from over 250,000 to 71,000 by helping people get a job. And I don't know if you know the numbers, but as part of this no verification, this crappy verification, what's happened? I know I think in Florida it doubled, Medicaid population doubled in that time frame. Which can you talk about the fraud in Medicaid?
Sure. There's 2 different ways that fraud happens in Medicaid on the enrollee side. You have somebody who's enrolled who's not eligible, and there's a bunch of mechanisms where somebody who's not eligible can be enrolled in Medicaid for a period of time before they're then disenrolled. But you also had, during the Obama administration, you took away states' ability to verify income and eligibility more regularly.
Why? Why would they do that? I mean, that doesn't seem to make much sense. That actually would allow fraud.
It would, because
that was intentional?
It was. They changed the rules.
It was intentional? They wanted more fraud?
Well, there's a lot of incentive for it because a lot of individuals make more money when they remain on the program longer.
If it wasn't to increase the fraud, why would they have done it?
I wonder the same thing.
So can you talk about provider tax, how that is, has cost the federal government massive amounts of money and basically allowed our states to just completely take advantage of the federal budget and federal taxpayer?
So the provider tax is probably one of the craziest money laundering schemes sanctioned by the federal government for states, where states can tax Medicaid managed care plans or they can tax Medicaid providers. Those providers pay the tax to the state, and then the state increases the payments to Medicaid managed care or to providers and draw down federal money.
Do they get the money back?
They do, and sometimes they get back even more than they collect, both on the provider side and the state side, particularly in Medicaid expansion states, because you have that $9 in federal money for every $1 in state money. So you have these incredibly perverse incentives to launder money from either Medicaid providers or now local governments to send that money to the state for the state to draw down additional federal money and then to use the difference for whatever programs they want and call it general fund money.
Thank you, Mr. Chairman.
Thank you. Okay, more clarification here. We've been hearing premiums double, premiums triple. First of all, do any of you know of any gross premiums that are doubling or tripling? Again, I put up the national average going about 26%. So what we're talking about net premiums, correct? Put this chart back up. I want to just show you this, Senator Scott. And again, trying to use Ms. Verstegen's example here just to illustrate. I'm not saying this is exact, but in terms of the numbers you've given us are this year you're paying $460 net, correct? And you got an $800 subsidy. That means your gross premium was $1,026 or $1,260. Okay, so you can see what the annual amounts in that would be. The other thing you've been telling us is you're going to pay about $700 this year if the enhanced premiums go away or enhanced subsidies go away. So again, we looked at a bronze plan. And what's so difficult about this is the premium rates are all over the board for different ages, and so it's just hard. So you can only take a look at one example, but I think this is, and I'm really asking our witnesses, does this look right to you then? So if that's what she paid last year and she's going to pay $700 this year, that means her premium, if it was going to go up 26%, it may not because Wisconsin is actually less, but somewhere in the $1,500 range, she'd be getting a subsidy of about $888, so more than she got last year, correct? And on an annualized basis, last year she got almost $10,000. This year she get more than $10,000. So what's going up is her net premium. And I'll keep arguing the reason your net premium is going up is because the gross premium is going up by a grotesque amount because of all the things we're talking about. There's no incentive for lowering costs. All the incentive is for insurance companies to keep raising their premium, and they get away with it because the federal government's their customer. The federal government, and the federal government's got Democrats that are just happy to throw hundreds of billions of dollars at the problem to mask the faulty design of Obamacare. That's what's going on here. So again, both Senator Scott and I, we are more than happy to work with Democrats to repair the damage of Obamacare, move to a system that will actually provide incentives. And that's generally through consumerism, through free market competition. All that's been driven out of health care. I mean, one of the things we talked about with Mr. White was the reliance on a third-party payer system. Again, we went from many, many decades ago where patients paid for 80% to now we pay for about 10%. So nobody knows anything costs, and nobody cares, other than everybody cares about their insurance cost. But when you don't care about the gross premium costs, because the federal government is subsidizing you to the tune of about $10,000 a year. You don't care about that. You don't care that it's $19,000. You just care about what you're paying. And I understand that, and families are struggling. But let's at least be honest in terms of what's happening here. I've got an article just came out today. Again, this is the media putting pressure. Extend these things because there's a couple. Apparently, I'm not sure this person actually exists. 60-year-old couple making around $85,000 in Barron County could see premiums skyrocket over 800% with an annual increase of $33,000 in costs. And I went, that's just not possible. But it is. That's what the premium is for a 60-year-old couple, $33,000. Now, it's going up that much because they obviously make more than 400% of the poverty line. And this is a couple, I don't know, we'll assume one of the reasons they thought they could retire, because they're retired. They don't get it through the employer. So these enhanced subsidies incentivize people to retire early, knowing they weren't going to have to pay much for health care. They weren't looking at the way the Democrats designed those enhanced premiums to expire and that they weren't going to be able to afford the unaffordable Obamacare. But just speak to that incentive, because we've heard this time and time again, and I think it was Dr. Blaze or Taryn talk about it's a kind of small group of people that aren't eligible yet for Medicare, who retired early, relying on those enhanced subsidies, and when they go away, because they make more than 400% of poverty level. Again, Obamacare was designed not to provide any subsidy to anybody making more than 400% of the poverty level, which is, I don't have that number. What is that for a family? It's like $123 a year, isn't it? For an individual, it's like 60 some.
Yeah, 123,000.
So if you're making more than $120,000 under original Obamacare, you didn't get any subsidy under the enhanced subsidies. Sky was the limit, basically.
Yeah,
right?
I mean, there was a news article a couple of weeks ago about an early retiree couple. They'd worked in government for 30 years. They had a $140,000 pension, and they, because of the COVID credits, qualify for a $15,000 subsidy now towards their health insurance. There's no asset test on these subsidies, right? You can have unlimited wealth and qualify these subsidies. It's based on income. Enormous incentive for, particularly if the enhanced subsidies are continued, for couples to retire early. We're also seeing big incentive for cities and states to dump their retiree health plans into the exchanges. So